Your veterinarian comes back in the room and says to you, your best friend has something you never ever imagined, the C word. No one ever wants to hear this. Now you've got a knot the size of the whole world in your stomach. What are you going to do? Well, today on our first part of our show, Dr. Kendra Pope joins us. She's a leading expert in veterinary oncology and one of the very few integrative oncology specialists in the U.S. She's going to talk to us about all the options other than just traditional cancer treatment. And we all want to know all the options, right? And then on the second half of the show, we see them all the time. Working dogs, military, police TSA dogs. But have you ever thought about what happens when these heroes have to retire? I really hadn't. Bob Bryant, a Mission K9 Rescue, he joins us. And wait till you hear the great things they're doing for these retirees. So sit back and get ready. Two guests that have so many interesting topics to discuss. You're really going to enjoy this one. It's a great episode. We are supported by PrepVet, providing stem cell therapy for pets.
As a pet lover, did you know your pet can benefit from the incredible healing power of stem cell therapy? Prep Therapy offers a groundbreaking solution taken right from your pet's own blood. Say goodbye to joint pain, arthritis, kidney and liver conditions, and more. They'll experience faster recovery, increased vitality, and extended quality of life without the need for surgery or harmful drugs. Put the wag back in their tail and discover Prep Therapy today at prepvet.com. Save 10% with promo code FurRealPodcast, covered by most pet insurance.
For real, 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 for real. Got a bunch of furry friends and I love them all the same. I'm an animal lover, veterinarian is the name. Let's share some pet stories from heartwarming to strange. Losses and gains, from wacky to insane. For real. You're now tuned in to For Real with your host, Mark Kyle.
Hey, everybody, and welcome back to the For Real podcast. Today is somebody that I really consider a friend. I got to know her a long time ago, but more importantly, she is a specialist in what she does. Not many people in the U.S. do this, and it's going to be really important for you to hear what she's got to say. Dr. Kendra Pope. Kendra, thanks so much for joining. I'm really excited for everybody to hear what you got to talk about.
Thanks, Mark. I'm happy to be here.
Well, let's start off. First off, let's tell everybody what you do. I'll let you do that. I could say it, but I know you're certified, but I'm certified in a different way, and everybody knows that. So let's let you tell everybody what you're doing and then how you got there, and then I'm going to start digging in with some questions.
Sure. So I'm a board certified veterinary oncologist, but my specific area of practice and niche is in integrative medicine and integrative oncology. So after I did all of my conventional training, I did this kind of whole other journey down a holistic rabbit hole and have built a practice around all of these really cool tools and really cool modalities. So we treat a lot of cancer, we treat a lot of chronic disease, but we also do what is my favorite, which is we do lots of prevention and wellness and basically just kind of serve as an extra partner on the team for all of our clients' pets.
Well, first of all, how somebody decides to get into oncology is a big decision there, but it's amazing to me. There's not that many in the U.S. that are actually specializing in oncology, and the fact that you're going integratively is a whole different realm, I would assume.
Yeah, there is. I think the last time that I tried to find the actual number of oncologists in the United States, I think it's something around 300, maybe 350 by now. I don't think there's any way it's more than 500 of us. So it's a small group to begin with. But then when you talk about the integrative oncologists, there's only 4 of us.
Wow.
So there's a few other ones that are interested in like acupuncture or maybe have taken some herbal courses. But the ones that are really like practicing integrative medicine day in and day out, there's kind of 4 of us that say that, we're doing it all the time.
Well, one thing that I know, and I know that schools are starting to teach some integrative medicine, but most vets that have been actually practicing for a while, it wasn't even available in school to them. And the ones that are actually teaching or practicing integrative, they did it on their own once they got out of school.
Oh, yeah, absolutely. So the study is actually getting pretty old now. I think it's probably about 10 years old. But when they surveyed all the veterinary schools to see how many of them have any type of integrative medicine in the curriculum, it was only 50%. And if you compare that to human medical schools, it's much higher than that. 90% of medical schools have some type of integrative, tracking. And that's not to teach the medical professionals how to do it. It's just to expose them so they even are aware and can ask questions. And so the problem is that, we're not training them. The only way that you can get this training is outside of your curriculum. So you really have to be committed to, making this part of your life's work, because you're not going to get any of this education in your regular didactic curriculum.
Well, I talk about this a lot on the show. I always think about it, and the more I delve into being in the podcast, obviously in the vet world, I'm there pretty regularly. But what typically, at least the way when I was growing up, and I would assume a lot of people, although things are changing, is it's a mindset, because animals have the same diseases that we have. They all the different things that we do as humans that we could do for animals to make their quality of life better. And again, if we're feeling bad these days, most people go get a massage, they'll get acupuncture or something like that. But you don't really think about that with animals. And here you're a lot more forward thinking than I was. And I've really come on to recently. So how'd you get there?
So I think most holistic practitioners will kind of tell you the same story. There's always usually a personal component, whether it's an animal or whether it's yourself. For me, it was both of those things. But the way that I fell down the holistic rabbit hole was I was in my second year of veterinary school. And, that's notoriously one of the most stressful ones, because your first year of school, you learn all the normals. Then your second year, you have to learn all the abnormals. And in my program, it was like, oh my gosh, I think that month we had like 20 exams in 4 weeks or something. It was something wild and intense. And I was getting chest pains. And so I did the whole regular spiel of going to the doctor and having the workup, and then they prescribed the anti-anxiety medications and said it wasn't my heart, it was just stress. And I took the conventionally prescribed drug, but then I promptly fell asleep. And then I woke up more stressed because I wasn't studying. And I just kind of, realized that that wasn't going to be a great solution for me. And around the same time, because I went to the University of Florida, which is one of the schools that very early exposes their students to a lot of integrative modalities, we were doing a lab about acupuncture, and they were talking about all of the stress management benefits. And so I investigated that a little bit further and decided I would want to give it a try. And sure enough, after that first treatment, they all went away. As long as I remained consistent, they would stay away. And so, it was just that aha moment of there are absolutely solutions out there that work and that can actually be a better option in certain situations.
Well, and what I love about integrative medicine, and actually in human and animals or pets, is it's more tools in the toolbox, right? Looking to find out, there's always another answer. Sometimes we think we have the answer and we're not getting, we think we have the question, but we can't find the answer. So finding something to help you find that answer is, to me, is relevant completely, and especially in the animal world.
Yeah, I think it's this really strange journey that integrative medicine has had and all of these tools. Because if you think about the things I'm talking about, acupuncture, herbal medicine, body work, stuff like that, they've been around forever. So much longer than any of our modern medicine. And at some point in time, once we started discovering all of these modern therapies, we decided they weren't good and we threw them out of the toolbox. They were always in the toolbox to begin with, but we got rid of them because we decided that, oh, this is better. But the reality is that the conditions and the diseases that we treat, especially when we're talking about really complicated, severe, life-threatening illnesses like cancer, there is no way that we want to be fighting that war with one or two things. We want as many as we can possibly have. And for some reason, the conventional community is threatened by the integrative wanting to be this or that. And it's not at all. It's just they're all in the toolbox and you pick out the tool that is most appropriate for what you're trying to achieve.
Well, and I actually call it old fashioned just because that's what I would think. I would think of my dad being the guy going, oh, that stuff is weird. I'm not going to do this. And then, of course, when you're going through something, if you're going through, like using cancer is a great example, and you don't know what's going to happen, you're going to try anything once you get your mindset to that point. One of the things I liked about your website, you've got that quote in there. think of cancer as a weed. And when you look at Western medicine, basically what Western medicine's job is to go in and basically pull that weed out. Where when you look at integrative medicine is actually the soil itself to keep the really to either keep it at bay or actually keep it from even getting in the soil in the first place. I think it just really defines it perfectly.
Oh, it's so true because, in our conventional medical system and as patients in conventional medical systems, we're taught to focus on diseases. And, if we really think about why that exists in our conventional systems, it's all because of insurance.
Right.
We need things coded for insurance coverages. So you have to be given or not given a diagnosis for your insurance to cover things. And so the way that all of the medical systems, human and animals, work around are Western diagnoses. But the reality of those is that it's not like one day you have, you don't have something and the next day you do. Everything's a continuum.
Mm-hmm.
Everything is this slow change over time. And so for us to just be focusing on tumors, focusing on diseases, completely forgets the entire environment that they developed in to begin with.
Well, it even comes down to nutrition, and I know you guys are doing stuff with nutrition as well because you're doing integrative medicine, which we can define here in a second. But, the old saying, you are what you eat. Well, the same thing goes with animals.
Absolutely. Yeah. It's the foundation of everything. When we do consults, when we do intakes, when we counsel new clients, it's, we have this pyramid that we walk through with them. And the very first step of every single thing we do is always about diet.
So let's talk about using integrative medicine for cancer. I know that's your specialty, except you're doing it across the board, but talk to me, traditionally Western medicine is, radiation, chemotherapy, and that kind of stuff. So do you combine them together or I really don't know. Surprisingly, you would think I would maybe know, but I don't. So walk me through, if I've got an animal who's been diagnosed with some form of cancer, I know my options are maybe my dog always makes sure that's barking when I'm on this thing. It's amazing. It's absolutely true.
He's like, don't say that you have an animal with cancer. Not me.
Yeah. No, it's not me.
Yeah.
No. Anyways, so I come in and I go into your office and I'm thinking, oh man, we're going to have to do radiation or chemotherapy. Walk me through however you want to walk me through it.
Yeah. The really beautiful thing about being a veterinary oncologist and not a human oncologist is that it gets to be the owner's choice.
Mm-hmm.
In human oncology, there's a lot of pressure for standard of care, which always starts with chemo or radiation, the conventional tools that we have. And so the really beautiful thing that I get to do is have an honest conversation with the owner and we get to talk about what's the right decision. Is chemotherapy or surgery or radiation or immunotherapy the right decision? Or maybe for whatever reason, we're going to forgo those and try other things instead. So I would say about half of our clients they do have patients that are undergoing conventional treatment like chemo or radiation. And then another half of them choose to either go it alone, either because it didn't work for them. They chose not to do it. They stopped doing it after they started it because it wasn't the right fit. So it's really always individualized and it's always based around the goals. So kind of the major things that we think about is, what are we trying to achieve? Is this, we're hitting, everything we can with the attempt to control and cure? Is this just supporting conventional treatments to try to minimize toxicity? Is this just keeping a patient comfortable doing hospice and palliative care? And then, the other things that come into play is how aggressive do the owners want to be? How many resources do they want to expend? How much time do they have? How much money do they want to, put into this? So it becomes a very tailored and individualized treatment plan for every patient. And there's really no protocols because it's always based on, the patient in front of you.
Mm-hmm. Well, it's kind of like customized medicine, the way I would look at it.
Yes.
So, what I saw a term the other day, I was reading it, and I think it makes a lot of sense too, is when you look at Western medicine and you look at it, Eastern medicine, which would be holistic and some of the stuff we're talking about, somebody used it as they used the description as the yin and the yang. Everybody at some point probably had that thing on their backpack or whatever the deal is, but they work together. And so it doesn't mean, I think one of the misperceptions for people out there that may be always looking at conventional medicine, doesn't mean you have to do one or the other. You can do both. You can do a hybrid or whatever. And I just think it's the only way to go with medicine. For anybody that's out there, if you look at the options and what you're doing in particular, I think it's amazing.
Yeah, there's no reason for us to, throw out any of them, because at some point in time they may become useful. And, I was recently having a conversation with another veterinary oncologist who is starting her own practice and is interested in, becoming an integrative oncologist. And I just remember saying to her, you're never going to regret doing this because you're always going to have something to offer your patient. One of the most defeating things, I think, when I was just practicing conventional medicine, especially conventional oncology, is at some point in time, you're going to be looking at your client in the face and saying, there's nothing else that I can do to help you. And then you have to send them on their way for the rest of their life, which could be very short. And when you have these other tools that can help support quality of life and appetite and comfort and fatigue and pain, even if you aren't able to cure the disease, there's always something that you can do to help that client and help that pet. And that's just a really empowering place to be.
Well, it's one of those deals when you hear the big C word, no matter if it's you or somebody else and your loved ones being one of your pets, that's a heavy time. And you want to know what the options are. The fact that you've got all these options is pretty cool.
Yeah, it's definitely, I agree with you. Like, there's just no reason to fight this fight with, one or two people on your team. You want as many as you possibly can have.
Well, one of the things I have when I was looking at your site too is when you're using integrative medicine, one of the benefits too, if you've had to do surgery with cancer, you're also doing, you're actually improving wound healing. You're doing other things. There's other stuff other than just that. And when you just think cancer, curing the cancer, there's other things that help give it a quality life, I guess.
Oh, yeah. And I think that that's the biggest mindset shift that we have to accomplish in our consultations with our clients. Because like I was mentioning before, we're all disease focused. All their goals are the same, cure the cancer. But in reality, if we focus too much on that, we're forgetting everything else that actually has a lot more effects and benefits. And when we talk about our conventional treatments versus our integrative treatments can be much stronger than our conventional ones and our traditional ones, but they also have vastly more side effects. Whereas our integrative treatments, generally speaking, almost all of them really don't have any side effects, or if they do, they're so mild, but they have this huge impact on quality of life. So even if we're not able to cure or we're not able to completely get something into remission, I've seen patient after patient that is just living with their cancer. And that's really where the focus should be. Even in, the media, the cure, focusing for a cure, research for a cure, raise money for a cure, it's insanity. The only cure for cancer is prevention. The only way we cure it is to not get it in the first place. If we get it, the best that we can do is keep it a chronic disease that doesn't shorten our lifespan or our health span. It just kind of hangs out with us like an annoying neighbor that doesn't go away. And so our focus is off. And that's why we rely so heavily on, these conventional treatments and think that they're going to work. But if you look at the actual data since about the 50s, even further back, the 20s, and the mortality rate with cancer in people, there has only been an improvement in 100 years of about 20%. And that 20% can be traced back to us stopping smoking and finally recognizing how bad cigarettes were for us. So if we've said after all of these billions of dollars that have been spent on trying to cure cancer, and the only thing that we've actually done has just taught people to stop smoking cigarettes and getting lung cancer, it's pathetic. It just needs to be handled differently.
Absolutely. I mean, I could slap you in the back and give you a big hug right now. I absolutely 100% believe that. It's crazy too. And you just look at, again, this goes back, it's funny, it's always about awareness, right? So I'm always trying to be more aware, and it's very, very difficult for me most of the time. But anyways, when I can be aware, and I said it earlier, it's a mindset when you talk about animals, if we could think of our animals as human beings, the way we would treat them, feed them, treat them, whatever, would drastically change the veterinary world, I would assume.
Yeah, I think that for whatever reason, there's this weird, block in our mind that dogs have to eat processed food every day, every meal for their entire lives. But if you think about it, we're the only medical profession in the entire world that tells their patients to eat processed food. Like every other medical profession knows that processed food is bad for you and real food is good for you. So how are we still stuck in this place where we literally say, don't give real food, don't give table scraps? It's just completely backwards.
Well, I have one answer to that. When you guys are going to vet schools, don't you have one of the big Purinas and that are supporting the schools, and the schools always support those kind of guys?
I know that that's something that's always brought up, and there's definitely undertones, that people worry about. And to be transparent, yes, we do have feeding programs where we do get free food, reduced cost food, and they do also pay for I don't know if all, but I know at least some of the residency programs for the nutritionists. And so, like in the medical schools with the pharmaceutical companies, there's bias in that.
Sure.
There's, things that need to be really honest about. But I also would turf it back to the veterinarians that then go into practice. Like, you also just have to use your common sense and think about this. When a client comes to you and they say, hey, doc, I look at what I feed my dog every day and it looks like this cardboard crunchies. Why would I feed them this when I'm eating real food every day? And then the doctor who's supposed to know better than you says, no, that's what's best for them. I mean, that's really something that I feel like I struggle now more than, all the time that passes by, the more I struggle with the fact that that's not something that more are thinking about. But what I will say is, with how many of these real food companies come out all the time, the pet parents get it and they're aware and they're putting their money where their mouths are. And that's why these companies are popping up left and right, because there's a huge market for them.
Well, and the cool thing about it is, too, that's absolutely right. So the supply and demand rule, right? So I'm seeing, by the way, I'm not bad mouthing Purina or anything. It's been around forever. That's what my dogs, when I was growing up, always had. But the bottom line is, all these companies they're creating healthier food for the animals. All of them are.
Yeah.
That's a supply and demand thing.
Yeah, it is. And, the big companies, one of them have purchased one of the fresh food companies. So I think that they understand, the importance of it. And also the reality is that, and I heard a board certified nutritionist say this, and it's absolutely correct. For some animals, that food, that kibble food, is a better option and is the best that pet parent can do. And so for some animals, that is the best nutrition. But the question that we need to ask is not if it's a minimal nutrition requirement, because that's what we base it off of, a minimal nutritional requirement. Is it what's optimal for my pet? And when we say that, when an owner wants to know what is optimal nutrition for their pet, that's where we really need to pause and ask the question, is this ultra processed food actually optimal?
And of course it's not at the end of the day.
No, it can't be. It can't.
And so getting back to working with the soil versus pulling the weed out, this is part of the soil.
Oh, yeah. I mean, the thing about nutrition is that we do it every day, multiple times a day. There's none of those other tools that we use. Herbs, you'll get them daily, but you'll eat food more often than you're taking your herbs. The treatments we'll do in the practice, with things like IV nutrients or things with, medical ozone or things with mistletoe or whatever. You'll do those too, but you're never going to, have the same repetitive medicine done as your diet. And if your foundation is broken or your foundation is deficient or your foundation is missing things, you're never going to be able to build anything on that strongly. So that's what you have to start with, because no amount of supplements, no amount of interventions, no amount of anything can fix a bad diet.
Well, it's a lifestyle thing. And again, this goes back comparing humans to animals. If we could change our mindset and treat them the same way we treat ourselves, you are what you eat, back by saying it to repeat myself, but we hear all the time on the human side, oh, that's carcinogenic, so we don't eat that. But do you say anything about it on the animal side? Never.
Yeah. I think that, there's some really amazing people who are trying to improve the transparency in the pet food industry, specifically for pet parents, so they can be making more informed decisions about the companies that they're purchasing from and that they're, putting their money into. And I think that, the reality is that there is a lot of, things that even veterinarians are unaware of. I mean, my mind was blown when I started learning some things, about the pet food industry that are allowed and considered feed grade and, allowed to be included. And so I think that although I'm a veterinarian and I advocate for pets, I think that this whole journey has also encouraged me to advocate for, more of our planet too. Because if we don't continue to be mindful of these practices, of what we're doing with, the animals that go into pet food and the animals that we eat, there's not going to be much left for any of us.
Exactly. I don't know much about the IV nutritionals you're doing, so talk a little bit about that. I'm curious about that.
Yeah, so there are certain reasons to maybe consider giving something like vitamin C or something like an herbal extract IV versus orally.
Mm-hmm.
Sometimes that is because a patient is so sick and their GI tract doesn't work well enough that you need to get a dose into them quickly, and you can do that IV and kind of bypass the gut. That's one reason to think about it. The other reason to think about it, and one of the main reasons that we do it, is because you often can achieve higher doses when you give something IV than you can orally. So vitamin C is a really good example. Both in dogs and in people, you kind of max out between 250 and 500 milligrams of vitamin C. You could take 5-10 times that orally, but your body's only going to be able to absorb about 250 to 500 milligrams at one time.
Oh, I didn't know that.
Yeah. Whereas, so like if you take more than 500, you're just going to be urinating the excess out. Whereas if you get an intravenous injection, you can go much, much higher than that. I mean, talk about 250 to 500 milligrams, you can go 25, 50, 100 grams intravenously. Now, your body is going to excrete it and it's not going to stay there for a long time. But the reason that you're going to try to get to those really high doses, specifically for cancer patients, is because they have selective cytotoxicity. And so what that means is that they can actually kill cancer cells and kind of cause those cancer cells to combust while not doing that to the normal healthy cells.
I wanted to ask you that question. I have a friend of mine in town here who's stage 4 prostate cancer, and he's going in for IV C right now. Just, again, looking at it from a human perspective, he's doing whatever he can to, have a quality of life and longevity.
Yeah, and the nice thing about botanicals and natural agents, and this makes them difficult to study in clinical research projects, but it makes them beautiful to use as tools. They often have lots of different actions that they do. So it's usually not just one thing. So even though that C dose does have that research benefit of having cancer cell killing capabilities, it also has proven to be really good for pain. It's been good for immune system function. It's been good for cancer-related fatigue. So he's probably seeing benefits from the vitamin C that's completely outside of his actual cancer.
Oh, that's interesting. I know it's really expensive. I forget what he's paying, but it's pretty crazy.
Yeah. Yeah, it depends, like everything else, right, where you go and how it's being done.
Tell me some more stuff that people should know that you're doing that they wouldn't know about normally. So these guys are listening. One, they're going to like you anyways because you're so cool. But aside from that, I mean, one of my favorite things when I first met you, we were talking and you were saying, I love researching. If I didn't like practicing, I would just research all the time. And I've always thought that was just one of the coolest. And I mean this truly. Every time I think of you, I think about that first time you tell me that.
That's so funny that's what you remember. Yeah, I guess there's kind of two things that I would think about. I'll mention the first one and then I can circle back to the research part because I do think that's important for people to be aware of too. The thing that my clients, I hear them say most commonly that they're confused about is, like after I'll lose a patient or a patient will pass away and, I'll be speaking with the owner, they'll say to me, they'll either say one of two things. The first thing is either, I hope I never have to see you again. And they mean that in a loving way.
Right.
Because their animal had cancer.
Of course.
Or they say, when I am ready and I get a new dog, I'm bringing them to you right away. And that's what I always tell the first set of people when they say that, is I say, no, you should see me as soon as you get an animal. Because the only way for us to really stop treating these horrible diseases is to prevent them from happening in the first place. And although conventional diagnostics like regular blood work and x-rays and ultrasounds, they can be helpful, but until there's overt disease, there's very little that's going to tell us is wrong. But if we're looking at things like, how is your diet? What type of toxins are in your environment? Do you have sluggish liver function? Do you need support after that round of antibiotics or conventional medications that you had? Should we just help your organs to function a little bit better? If we're thinking about that all the time for their entire lives, that's going to be a vastly different outcome than if we're forgetting all of that. So the first thing that I would say that people should know is that integrative medicine isn't just meant to be extra tools in the toolbox to fight disease. Those are really the foundational tools to prevent disease. Things like diet and supplement and these natural interventions, that's where they're most effective, is in prevention. So that would be the first thing I would say. And then the second about the research is, people, when you say you are interested in research, I think they think about like experimenting on mice and, this weird stuff in the lab. But the thing about clinical research that really is just fascinates me and like has my heart is that this is the only way that we prove legitimacy to the medicine that we're doing. We need to speak the language of our conventional partners and colleagues, and we do that through research. And the thing about doing projects, like let's say we put together one project that's actually is going to be coming soon imminently. It's about dogs that have brain tumors and that get put on steroid, which is considered palliative care. We're going to add in herbs and see how they do and how their longevity and their quality of life improves. If we can prove something as simple as that works in a population of dogs, that data can be used on the human side to get studies funded for humans. And so just like you said, these pets in our lives not only are family members and mean the world to us, but they're canaries in the coal mines. And they are the foundation of what we should be building research off of for humans. Because studying cancer in mice and rats that have been injected with tumors is completely different than the dogs and cats that live in our houses and are exposed to the same things and the same toxicities and the same, poor environments that we are. And so there's no money in any of that because there's nothing patentable. There's no drugs, there's no pharmaceuticals. So keeping your eye out for, projects like that can be supported, that's where the money needs to go because that's the direction we need to follow.
Well, one of the things that I found fascinating when I first got involved in the vet world, which is obviously, several years ago, is that when they're doing studies with some new technology, whatever it is, in the pet world, it's 6 or 7 dogs or whatever it is, where humans, it's thousands. Now, on first glance, that may sound bad, but the problem we have in the US is, or when we're doing humans, the studies, while they're being protected because it's a human life, is that it takes forever to get something out. So you don't know if it's working, where at least what you're talking about, it's the same thing with research. If you've come up with something that's good and they find out through these studies there, the potential, I would think, way more than the downside.
Yeah, there's so many reasons that dogs and cats serve as such great models because first of all, like I mentioned, they're the spontaneous disease. It's not like we're making it up in a lab, but it's exactly what you said. It's less expensive to do and their lives are shorter. So the same amount of data can be obtained in, half of the time, a third of the time, maybe even shorter than that.
Well, we could go on and on about that. Anything else you want to talk about? I mean, first of all, I love talking to you, and this is a genuine thing. Again, you said you're research. I just think it's because you're so smart. That's why I'm hoping somebody rubs off on me.
I'm just one of those lifelong learners. I just am fascinated. Like you said, the decision to do oncology, I think that people who are drawn to that, it's always for a certain reason. There's something, that they're meant to do in that space, but it's also the most complex, most interesting disease. I mean, it is just ever changing, ever evolving. No matter what you do, it's going to outsmart you. I mean, you're never going to not be humble when you're treating cancer every day.
Well, and good thing we have people like you looking out at it, right?
Thank you.
I mean, but you know what? It's like I said when I started doing this podcast, everything's fascinating to me. And I love stories like that. I love talking to people like yourself. Again, I'm hoping they're going to rub off on me, but more importantly, I get to find out all these really, interesting stories and do all this stuff. So at the end of the show, every time I tell a joke. Well, actually, before I do that, let's let everybody know how they can contact you, Kendra. I know you're jammed all the time. So I don't know. I didn't ask you if you wanted me to do that, but for you guys to have questions, she's awesome. And if, she's in New Jersey. By the way, where's that in relation to where you were before? I saw that we're in Denton or whatever.
Oh yeah, just 10 minutes from where I was before.
Yeah. Oh, by the way, so I was in her first clinic that she had, and it was this really cute little space. And I actually had somebody on earlier today, and now I'm sure her space is really nice too, because one of the things I mentioned about this other space, these people, it's another integrative vet, by the way, but their space was so much less intimidating. And I think animals take on that energy. If it feels calm in that, they're going to probably be less stressed going into a facility. I'm assuming just like yours is now.
Oh, yeah. I just had a conversation with another integrative veterinarian who owns her own practice too. And we were talking about that. And she had mentioned, she was like, my clients, they just always say the same thing. They always say, they're just so happy to come here. They're never scared to come here. They never shake when they come here. And that's what we hear all the time. It's the same thing. It's definitely, they're absolutely sensitive to it and they absolutely pick up on that stuff.
This is for a different conversation because I could have you on here for hours, but dogs do know. I mean, it's funny how you ever notice dogs or cats, even dogs for the most part, but they like some people and they don't like others. I always wonder why they don't like that person.
Because they're smart and you have to listen to that.
Yeah, exactly.
They know way more than we do.
Oh, positively, whether people think it's hokey pokey or whatever, dogs, they read energy, whatever that is, they do. And so if they're going to a space that's nicer and they feel calm about it, there's something about that.
I agree.
And so that must mean you're doing the right thing. So anyways, if people want to get a hold of you, how do they get a hold of you? How do they follow you on social media and all that kind of stuff?
So our practice is in Tinton Falls, New Jersey, and it's called Prism Integrative Veterinary Health. And you can go right to our website at prismvethealth.com, or you can follow us on Instagram or Facebook at Prism Vet Health. As far as me and my nonprofit and my research endeavors and my education, you can follow me at Dr. Kendra Pope on all the social, on Instagram and Facebook and YouTube. And then drkendrapope.com is where you can find information about me and my education, as well as my clinical trials that I'm part of.
And there are probably 5,000 of those things, guys, but it's certainly worth to do and follow all those things. You'll really, and if you got questions, you can always ask me. So this is the part where everybody kind of cringes when I say it, but I have my animal joke today. Well, it's not an animal, but it's in the animal world that I'm going to at least say it is. So let me tell you the joke and then we'll go from there. So did you hear about the racing snail who got rid of his shell?
No.
He thought it would make him faster, but he became more sluggish.
Get it?
I get it. Okay, guys, if you've got a good joke, because obviously I need better jokes on this show, please send them in to me. We'll record it. If you want your children to do it, one of your favorite friends, whatever, and want to be on the show, please do that. Or if you've got great information for the show, something you think would be really relevant, send them in to me and I'll respond directly. My email is mkyle, Kyle, at for real, that's 2 R's, FURREAL podcast.com. mkyle at forrealpodcast.com. Kendra, I always love talking to you. I so appreciate, I know you're jammed all the time. You taking the time really means a lot to me. And thanks so much for being on the show.
I was happy to do it. Thank you.
And everybody out there, keep listening and spread the word because we got cool people like her on the show all the time. For real. We're supported by Let's Walk, that's here to love your animals like our own.
Austin, Houston, and Denver. Let's Walk is here to love your animals like our own. From daily walks, play, in-house sleepovers, and more. Go to work, out on the town, or take a vacation knowing your pets are in the best hands. This woman-owned small business does it all. Check us out on Instagram at Let's Walk Austin, Houston, and Denver.
We're back. The second half of the show, this one, I guarantee most of you haven't even thought about. What happens to those dogs when you're going through the TSA line in the airport or the military dogs you see in the movies these days? I never really thought about this until I got a chance to meet these people, but what happens to dogs when they're done working? Where do they go? Well, today I've got Bob Bryant with Mission Canine Rescue. So I really appreciate you taking the time to do this. I know you guys are busy and are doing a great job. So Bob, welcome to the show. And I'm sure everybody's going to be really excited what you've got to talk about.
Mark, glad to be on today and appreciate you reaching out to us. I'd be happy to cover any topic you'd like to.
Well, I've got some notes, and of course, whatever you want to talk about is good with me too. But just to start off, I was looking at your guys, I think it's your mission statement, and I call it the 6 R's, but you've got, what you guys do is you rescue, reunite, rehabilitate, repair retired working dogs. Tell me a little bit about this, and maybe let's just go step by step. Rescue, then let's talk about that.
I'll go through it. First of all, there's 5 steps. It's rescue, reunite, rehome, rehabilitate, and repair. With rescue, Mission Canine is committed to saving any and all military working dogs and contract working dogs. Contract working dogs are just privately owned dogs that are trained the same as the military dogs, as well as any other working dog that might need help, such as retired police canines. This work might include bringing them back from overseas or rescuing them from a poor environment here stateside. Reunite is our second R. We prioritize reuniting retired military working dogs with their past handlers. Military working dogs can have up to 5 handlers, and when they're retired, one of the handlers gets the dog, and we facilitate that. It can be very expensive for the service member to bring their dog home from overseas, often as much as $6,000 from a place like Japan or Korea or even Guam, and they just don't have those resources. So we facilitate that. Rehome, if a dog doesn't have a designated handler, we will work tirelessly to find a loving home for that dog and a place that fits for him or her. Rehabilitate, these dogs train like athletes. They've been in traumatizing circumstances. A lot of them have had severe anxiety and stress, and a lot of them have PTSD. They need time to decompress, reintegrate, and we work with them as long as necessary to help them be suitable for adoption. And the last one, repair. Again, they train like professional athletes their whole career. When they retire, they've also often got expensive and costly medical issues. And since these dogs don't have any retirement benefits, we raise the funding to assist them with their bills.
Yeah, you know what I read something about, which really kind of shocks me. Doesn't shock me, but does shock me. So if you're in the military and you're a handler of this dog and you retire, you're going to get retirement. But these dogs, the minute they're and they're in retirement and out of the military situation, they don't get anything. They don't get health benefits or anything. And what you guys are doing is offering something that the military really should be offering them as well.
Yes, they should. These dogs, unfortunately, are still classified as equipment, not soldier assets.
But one thing I read about military that I thought was really interesting is generally a lot of these dogs in the military are ranked one rank above their handler. Did you know that?
Okay, respectfully, that's
not true.
Old wives' tale nonsense. It has been said because, if you strike your military working dog, you're hitting a quote unquote senior officer. It's just not true. But that rumor has circulated for a number of years that the dogs are ranked. They're not.
Oh, well, I'm actually kind of bummed about that. But the one I read, I did read, I was thinking that would be great because then they would be the boss. But I read 2 reasons. One was exactly what you were saying. The other one is just done out of respect. They're considered NCOs though, right? Or not?
No.
Oh, they're not.
No, they're considered equipment.
So everybody that does Google searches on the internet know that everything on it's not true.
That's true. Yeah. Well, it's interesting. Just this morning, I'm a ChatGPT Plus subscriber. I love it. It's enabled me to do 4 times as much work in half the time and do it correctly. They've now incorporated a current web browsing feature. I asked it, what organizations brought home the most military working dogs? And it turned around and it said, the American Humane Association. I choked with a spear in my brain at that point. I said, oh, no, they haven't. They brought home about 15. We brought home 640 that have been reunited. So the internet, unfortunately, is full of other people's opinions that they pass along as truth.
I think chat's a great tool, but I've certainly caught it in telling things out there that are it's just not true. They've heard it.
Oh, yeah.
You can train it.
Yes, you can.
So we talked about contract working dogs. Basically, contract working dogs could be anything from police department across the board, right?
Okay, let's talk about the police canines. PD canines are a unique category in and of themselves. They're generally trained overseas. Some are trained in the States. Most are trained overseas, and they're brought in specifically for that task, either just patrol and drug searches. Contract working dogs, otherwise, these dogs are owned by private companies. They're generally deployed overseas with foreign handlers, and they will be doing like bomb detection at ports, drug detection, things like that. often patrol work as well. And in the United States, we have some contract working dogs that do a very unusual job, and that is citrus pest detection in orchards. They've trained Belgian Malinois to detect certain type of citrus disease, and these dogs run in the orchards and they will alert on diseased trees so that the orchard owner, I don't know if you call it an orchard person or whatever the term is, they don't have to kill their whole orchard. They can take out a single tree.
Wow. I didn't know that, but I see with a lot of they're using dogs or training dogs to detect different kinds of disease states. I know that there were some dogs that were actually, I think it was in Europe, that were trying to detect COVID.
Well, they actually, yeah, they do have COVID dogs. I think it's the University of Arkansas, a professor named, I think his name is Arnie Ferrando. He has dogs that can detect prostate cancer just by, the smell from whatever.
Wow.
And we have dogs that do bed bug detection, lots of things. We have one of the most interesting dogs, and by the way, one of these dogs ever retires, it's mine. These dogs detect currency.
I had somebody to talk about this. So I had a guy on the show because I do some just pet owner stories, crazy story, a dog that actually ate $1,000. His wife was an attorney, and somebody given him cash for this. I think it was a drug dealer or something, giving him $1,000. He wakes up and the dog had eaten almost all of it. So you guess how they had to get it back?
I know exactly how they got it back. Trust me.
Exactly.
One of my most interesting stories. I had a Belgian Malinois that was somewhat neurotic, and he would eat anything he possibly could. One day, we were missing the cat blanket. We couldn't find it. The next day, this dog is out squeezing and doing the accordion dance, and I see a little bit of pink coming out where it shouldn't.
Oh, God.
I then proceeded to grab that piece of pink and continue to gently pull it. 4 feet long came out. Cat blanket.
Yuck. That's okay. Let's not talk about that anymore.
Strange but true.
Oh, I know. They're dogs. So I actually, since you brought up the Belgian dogs, let's talk about the dogs you normally are rescuing because everybody assumes it's just shepherds. And you and I have talked about this before, but
Right.
it was good information. And let's walk through
Sure.
which ones you normally get and why you get those certain ones.
Sure. The Belgian Malinois is the dog that we're going to most commonly encounter in a situation as a military working dog. In fact, the Lackland Joint Task Force Base military working dog program in San Antonio I think they still train a few Labrador retrievers, but it's like 98% Belgian Malinois. And they moved to the Malinois over the Shepherd because the Malinois is faster, it's lighter, it's not as prone to have hip issues, and to be quite frank with you, they're borderline insane. These dogs have just crazy work drive. Those are the main dogs we see. We still see some German Shepherds coming back from places like Afghanistan where contract working dogs were left stranded, even though the United States government says, oh, no, no, no. Well, the 6 we brought home say, oh, yes, they were.
Right.
German Shepherds, we'll still see a good number of them coming as contract working dogs. Labrador retrievers, used predominantly for both bomb and drug dogs worldwide. And the TSA will use Labradors. They will use German short-haired pointers and English Springer Spaniels for their bomb search dogs at the airports. And I asked you the question, and I'll just let you repeat it if you remember it, and that was, why do they use these dogs when they could use a Belgian Malinois that's just as capable?
Well, I know the answer now because they're more intimidating looking.
That's right. They're not. The Malinois is a scary looking dog, and the grandma at the airport that the dog comes up and sniffs may have may have a stroke when the dog does it, where she's going to smile if a Springer Spaniel or Lab walks up to her.
Well, it's funny the more I do these podcasts, it's usually logical answers to everything.
Mm-hmm.
The old keep it simple, stupid deal, the KISS principle, but you never think about it because simple is not easy to figure out half the time.
Right. That's true.
So I saw a YouTube, I think on your website about your Kuwait experience.
Oh, yeah.
Tell me that story. And it's pretty amazing. So it's a great story for everybody to hear.
Yeah, this was back in 2016. We found out that there was a contract working dog operator operating over in Kuwait that had been mistreating the dog handlers. These were Filipino workers. Basically, he took all their passports and basically made them work for free. Well, these Filipinos retaliated by euthanizing a bunch of working dogs and posing with them in a big pile.
Oh my God.
And we saw this and we were determined that we didn't want this to happen again. So we reached out to this contractor, and let me make very clear, by no means were we befriending these people. They treated their dogs horrible. They treated their staff horrible. And, basically they were enslaving both their dogs and their people. But we found a way to get them out of an otherwise nasty situation by agreeing to take in the rest of the dogs that we had over there. We brought home, I think it was 15 or 16 dogs at the time. And by the way, that contractor is out of business, gone, history. I doubt they'll ever get another contract again, nor should they.
No, they shouldn't at all. Absolutely. Well, good for you guys. I mean, again, when I started the podcast is you don't realize these dogs are out there, but you don't really think about what happens to them when they can't do it anymore. And you guys are doing some pretty amazing stuff. One of the things I read is that there's currently 1,600 active military dogs, roughly.
That's a good number. Mm-hmm.
And then I think combined with the contract working dogs and military dogs, it's around 5,000 that are active.
Sounds like I know somebody that wrote that.
Oh, was that you?
It may have been me. Yeah, those are correct numbers.
Hey, wow. So, well, maybe the internet did a good job this time. I don't know.
Maybe the combined the working dog force worldwide, I'd say, is between 5,000 and 6,000.
Well, again, let's go back to the deal with when these dogs retire, they're not taken care of any financial way. They did their job. See you later. On to the next dog. Let's talk about everything you guys do. And I know you've got a bunch of dogs in your facility. So let's dig into that, and so people understand you can hear it. Okay, we rescue the dogs, we get them out there, but there's a lot more to it. So let's walk through all that.
Okay, first of all, just to clarify, when a military dog is retired, the dog is still kenneled, the dog is still fed, the dog still gets medical. These are not abuse, horror, oh, we've got to get the dog out, it's going to die situations.
Oh, yeah.
With contract working dogs, that's not always the case. In many situations, when a dog loses its workability, gets stuck in the kennel, almost never sees the light of day again, and maybe get 50% of the food, and we'll get a dog that's half the weight it's supposed to be when it comes home. And obviously there is significant trauma that comes along with that level of mistreatment. So when we rescue these dogs, we take them into our facility in Magnolia, Texas. We call it the Veteran Canine Ranch. And they go through the process of, first of all, having all their veterinary needs evaluated and met. We get them any type of medical treatment that they need. We determine their psychological makeup, their aggression nature, what their triggers are, if anything. And then we work with them to try to teach them just how to be a pet, not how to be a working dog. They don't have to detect the bomb. They don't have to chase the bad guy. They don't have to, go in a building that's about to fall down. We just try to get them to be normal dogs. And then over about a 3-month process, most of them are ready for adoption at that time. We know their makeup. We know if they're friendly to other dogs or cats or just what their triggers are. And then we make a good decision on who adopts them based on that period.
Well, it's like humans. They've got to adapt to being retired too. So the dog's got to learn. It takes them a few months to know that they can go fishing now.
Yeah, I doubt I'll ever retire. I like what I do too much.
Yeah, but I'm talking about people that do, and you've got these dogs there. So do you have somebody go into families with kids? Are they just too overworked and stressed and not really being in a family environment? Or do some go to families?
Normally, we don't adopt to families with kids under 12 unless there is specific working dog ownership experience there. If they've had big dogs, and we vet the adopters very, very thoroughly. The main thing we want to make sure of is that they can afford the cost of care and that they have the time to spend with the dog to give it the enrichment and the activity that they must have. But little kids, candidly, can be an issue. especially if you have dogs with crazy strong toy drives, which all the dogs that we work with do. Kid's got the toy, the dog wants the toy, the dog grabs the toy, doesn't really realize the kid's hand's still there, but he's got the toy.
Right.
All of a sudden, we got a big problem.
For you guys listening out there, so if you've got a family, that's probably not the ideal situation. There may be. I mean, obviously, if they, when you go through the process, what's the process? You do like an interview process with the families, or how does that work?
Yes, we do. We have an application process, which you can start on our website. It's missionk9rescue.org, and you would select the menu at the top that says adopt. All of the adoption criteria is very plainly spelled out. Timing is very plainly spelled out. And there is an application that we manage through Pet Establish, whereby they will put their information that we need to know about it. Who's your current veterinarian? How many dogs do you have? What's your family like? Now, there are some situations where we have adopted, to families with younger kids, but it truly depends on the dog.
Of course it does. So I saw a video of, it's not just about the dog sometimes, because when they go back to the handlers, it's healing for the handlers as well. It's not just the dogs.
Oh, the handlers. So the reunions are some of the best things that you'll ever have the opportunity to witness. In every case, the dog has immediately recognized his handler, his friend, and it's just like that bond is back there again, like it was never broken. It's a very cool thing to witness.
Well, the one video I saw was the Vietnam vet that you guys had. That
was Lloyd.
Yeah.
Yeah.
Just tell everybody that story. I mean, I love heartwarming stories. It's one of those goosebumps.
Unfortunately, during the Vietnam War, the working dogs that went over and served our country were either euthanized or abandoned when their service was over. And this left a lot of handlers with literally holes in their guts over it. They had no idea. One day their dog's taken from them, he gets the needle. And it's something that many of them have had lasting trauma over. We were able this was back in 2016, we had Lloyd, who was a Vietnam War veteran, and he had a dog, and his dog was euthanized at the end of it, and he never recovered from it. We were able to adopt to him a contract working dog named Hank, and I recall exactly what he said. He said, Hank is going to heal a hole in my heart.
Oh.
And in fact, he did.
Those are the kind of stories we all want to hear. Really, those are the kind. Now, one of the things you guys say in your thing is you're giving them the retirement they deserve, but on the other side of the coin, you're also giving the handlers a little bit of their retirement that they deserve as well.
That's correct. We just try to give back to those people who've given everything pretty unselfishly.
Well, I know one of the things, when you think about it, some of these dogs, when they get back, there was some euthanasia going on, and you guys are really doing something to help curb that, because some are you can't get them in a normal environment, but it's a lot smaller than I would have expected prior to doing research on there, but it's significantly less than that, but still it does happen, right?
Dogs that are euthanized generally are hyper aggressive with multiple bites on their record. These are dogs that will just snap for no reason. And I can understand that. I would rather see a dog peacefully pass than to live a life of hell in a little kennel for the rest of its life, because, it can't be touched by humans. And it's humans that fail that dog.
Right.
And in the end, we are the ones responsible. Well, we aren't, but the ones that train the dogs are responsible. And the military routinely euthanized military working dogs back until 2009, when the law known as Robbie's Law was passed that stopped that practice.
Good. That's really good. Well, I say this on the show all the time. It's not a dog problem. It's a human problem.
It is. And sometimes euthanasia is not the bad thing. It's
humane.
Painted to be. Yeah, it is. It's the best thing you can do for the dog. And I know people won't agree with that, but after 1,250 dogs, I think I'm in a position to comment on it.
Yeah. By the way, we didn't say this earlier. You guys have you've rescued 1,250 dogs and rehomed them, basically.
We've rescued over 1,250, and 640 or so of those were reunited with former handlers. The rest were adopted out. Correct.
So about 50% go to the handlers and the other ones. One of the things I read too, which I thought was interesting, if a handler was lost in battle, that oftentimes these animals actually go to the family of the handlers because they want to be closer to their kids.
That's correct.
Yeah.
That's correct. I know of a couple of Gold Star parents who have their sons working dogs, and again, it helps preserve that connection that they had to their family member.
Healing for both.
Yes,
just what it is.
Correct.
Now, I've read another thing, and tell me where this may be wrong too. So there's a agency in the government called the U.S. Government Accountability Office.
Mm-hmm.
I don't know it's for mismanagement. And they found, and I didn't dig too deep into it, which again, this is the reason I bring it up is the value what you guys are offering. It's oftentimes these animals are mismanaged, not mistreated, mismanaged, not in a way that's most beneficial for the animals. So they get done. And of course, the government's doing this to make sure that they're managed better. But again, you guys are offering something to help these animals that may have been, using the term, mismanaged, not mistreated.
Yeah, to me, the government doesn't manage anything well, but I'll just leave that at this point. As far as the working dogs go, they're pretty much hands off. The military, the contract working dog world is not really regulated at all. I'd love to see some regulation there. What we want to see regulation wise is that these dogs get a chance to retire a little bit earlier. Working dogs are retired when they lose their drive, or when they get or when they have a medical issue. And sometimes I've seen a military working dog that was retired at 13. The dog lived 6 months. What a life.
Right.
But we'd like to see dogs retired at 8 years old. It still gives them a little time to decompress and have a not work life.
So what's the average age now that you guys typically see? I mean, I'm
9 to 10. 9 to 10.
And dogs usually live some 12 years, 13 years.
12 to 14. My Labrador Oreo, I got him, he was 8. He lived until he was 14. Some pass at 12. It just depends. The main thing we see with a lot of these dogs that were explosive detection dogs is they develop cancers of different sorts from the compounds they were around, and also for the compounds that are used to clean their environment, their kennels. There's a real nasty bleach product they use, and it can give a dog an eye disease. It's just nasty. So,
are they doing anything to regulate that, knowing that these animals are getting that?
No,
of course not.
To be very candid with you, I have never heard of this government, whatever it is, that's supposed to oversee these dogs. If there is one, I can tell you they're not doing anything.
Right. Well, it's the government. I agree with you on that one too.
Yes, government.
Well, one of the things I always think about, and it reminded me when I watched some of the videos, they're so excited, one, to see their handlers, or they're just getting there and using the term, they look like puppies again.
Yeah, they do. They act just like puppies. There's a video on our Facebook page, which is named Mission K9. If anybody wants to see a super cool reunion, we just had one the other day. I don't remember. Oh, it was in Korea. Labrador Retriever. It's very, very short. It's probably like 4 seconds, but you see the handler call this dog, and this dog goes streaking toward the handler. He knew exactly who it was. It's pretty cool.
I wish humans were as loyal as dogs.
Yeah, well.
Okay, so tell everybody, I know you've mentioned it earlier, but tell everybody how, one, to follow you guys and where they can follow you, your guys' website, what they can do if they're thinking, well, I'd love to maybe adopt one of these dogs or whatever. Walk them through everything. Actually, one more important thing is what they can do to help provide you. I know it's a real expensive thing to do. One of the things I do when I'm getting ready to have somebody in the show is I do a lot of research on how good they are. And you guys, every person I've talked to, everything that I've done without looking into standard states, standard sites, is you guys are ranked so high and you're so respected in the industry across the board with military people and that. So that's something, a pat on your back for that. But if you can tell everybody how to get a hold of you or follow you or whatever, just throw it in there.
All right. If you're interested in adopting, you need to visit our website. That's missionk9rescue.com. the letters K and 9. You can go to the adoption menu link, and then on that link, you'll find our adoption criteria as well as an application that you can fill out. Your application will be reviewed. Then our adoption coordinator, Blair Baker, will reach back out to you. If you'd like to donate to us, you can also go to our website and do that. The big donate button's right there in your face. We take recurring as well as single donations, and we're grateful. We don't care if it's $5 or $500,000. We will use either equally. And one thing I think it's important that anyone interested in supporting nonprofits in general should, first of all, be aware of what they spend toward their mission. There are many company or orgs out there that put just 60% of your hard-earned money toward their work. The rest of it, they're given to marketing companies. If some of the times it doesn't even go to the work. We spend 90% or more toward the actual funding to our service to the dogs. Nothing goes to waste. And sometimes we have our nose just barely above water, but we're making it. And I will say that the nature of a nonprofit is to have his hand stuck out and ask for money, but we truly honor these dogs with your donations, and we walk the walk. No money is ever wasted.
That's great. Now, if people want to follow you on social media, do you have all the usual things?
Yes. Mission K9 on Instagram and Facebook. I have no desire to be on Twitter or X or whatever it's called. No real use for it. I think we've got an account there, but don't look for anything new. There's not anything.
Okay.
I am being a little better about blogging on our website, but to be quite candid with you, we're doing so much work. There's just not a lot of time to write blog articles. We don't generally hire bloggers because they don't really understand what we do.
Well, great. So this is the part of the show, I forewarned you, and if you don't have one there, where I ask everybody, the guests, if they've got a joke, and of course, I always offer a joke if you don't have one. Do you have a joke for us today?
Let me think a second. Joke. You know, you talked about the other day, and I brain farted.
Well, I've got one. Don't worry about it. I got one.
Tell me your joke, because I'm a loser when it comes to a joke right now.
Oh, well, first of all, my jokes, first off, as everybody knows, are not very good. So here's my joke today. How did the little Scottish dog react when he met the Loch Ness Monster?
I don't know. Tell me how the little Scotty dog reacted when he met the Loch Ness Monster.
He was terrier-fied.
I do have a joke.
Okay, go for it.
What do you get if you cross an elephant and a rhinoceros?
What do you get?
Elephino.
There's a good one. See, you had one.
Yeah.
So for everybody out there listening, I do this every week, as you well know, but I'm always looking for people that actually want to share a joke with us and to be on the show. So if you want to be on the show, obviously I need some help with my jokes. At least Bob had a better one than I did. But if you've got a good joke, or you want to be on, or you want your kids to be on, or one of your friends to be on, you can send an email to me directly, mkyle, K-Y-L-E, M like in Mark, mkyle at forreal, F-U-R-R-E-A-L, podcast.com. Or if you've got a story or whatever you've got in organizations you think would be great for the show, please send it to us, because we really, really want that information. And certainly, I'm sure for you guys that listen, you want somebody else to tell a joke versus me. So, Bob, thanks so much for being on the show. I really, really appreciate it. And to all the listeners out there, I can't tell you how much I appreciate that. And please pass the word out to everybody so they'll follow, because the more followers we get, probably more interesting stories we'll be able to find out there as well. So everybody have a great day, and see you next week. For real.
Thank you, Mark.
Take care. Bye-bye.
For real, 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 for real.
We are supported by PrepVet, providing stem cell therapy for pets.
As a pet lover, did you know your pet can benefit from the incredible healing power of stem cell therapy? Prep Therapy offers a groundbreaking solution taken right from your pet's own blood. Say goodbye to joint pain, arthritis, kidney and liver conditions, and more. They'll experience faster recovery, increased vitality, and extended quality of life without the need for surgery or harmful drugs. Put the wag back in their tail and discover Prep Therapy today at prepvet.com. Save 10% with promo code FurRealPodcast, covered by most pet insurance.
That concludes this episode of For Real with your host, Mark Kyle. For previous and future episodes of For Real, Listen via all major podcast streaming sites.